Syprine is a medication used to treat a specific inherited disorder called Wilson's disease. This disorder leads to an excessive buildup of copper in the liver, brain, and other parts of the body. Syprine works by attaching to the copper, which assists the body in removing the extra copper. This can help reduce symptoms such as speech and swallowing difficulties, tiredness, lack of appetite, abdominal pain, yellowing of the eyes and skin, fluid retention in the legs and abdomen, uncontrolled movements, and muscle stiffness. When taking Syprine, it's important to follow your doctor's instructions. Take it on an empty stomach, at least 1 hour before or 2 hours after meals, usually 2 to 4 times daily. If you're taking the capsule form, swallow the capsules whole with water. Don't open or chew them. If you accidentally touch the capsule contents, wash the area with water. For the tablet form, don't crush, chew, or dissolve the tablets. If you're taking a medication called penicillamine, follow your doctor's instructions before starting Syprine. The dosage is based on your medical condition and response to treatment, so don't change it without checking with your doctor. If your doctor tells you to take an iron supplement, take it at least 2 hours before or after Syprine. Use it regularly at the same times each day for the best results. Don't increase your dose or use it more often or for longer than prescribed. And if you notice any worsening symptoms or don't get better, tell your doctor right away. This medication is prescribed by your doctor because they believe it will help you more than it will harm you. However, it's important to be aware that this medication, along with a low-copper diet, may increase the risk for iron deficiency. If you experience symptoms like feeling very tired, weakness, pale skin, chest pain, fast heartbeat, shortness of breath, or cold hands/feet, be sure to tell your doctor right away. They may recommend an iron supplement for a short time. Although it is rare, a very serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice or report side effects to Health Canada. Before taking Syprine, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your healthcare provider before using Syprine. If you're planning to have surgery, let your doctor or dentist know about all the products you're using, including prescription drugs, over-the-counter medications, and herbal products. Women who are pregnant or breastfeeding should talk to their doctor about the potential risks and benefits of using Syprine. Remember, drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much Syprine and has severe symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they should contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to not share Syprine with others. Your doctor may also want you to have lab or medical tests while you're taking this medication, like blood or urine tests to check your copper levels. It's also important to keep all your medical and lab appointments. And for the best results, make sure to follow a low-copper diet as directed by your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just wait and take the next one as scheduled. Don't take extra to make up for the missed dose. The medication Syprine may have different storage requirements depending on the brand. Be sure to check the product packaging for specific instructions or ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Syprine, do not flush it down the toilet or pour it down the drain unless directed. Instead, properly discard the medication when it expires or is no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.